Well, good afternoon, everyone. It's so wonderful to see everyone out here for this wonderful discussion that we will have this afternoon. Look at the bright and beautiful faces on the screen. It's my pleasure to make some introductions. So my name is Isilma Fergus. I'm an immediate past president of the Westchester Board of the American Heart Association. I'm currently director of Cardiovascular Disparities Center at Mount Sinai, and I'm a proud volunteer of the American Heart Association and member of the Paul Dudley White Society. So welcome everyone. And thank you to all of our society members, all of the volunteers, everyone who gives to the American Heart Association, board members, and invited guests. Welcome to this very special program. This evening, we have the pleasure of having Dr. Mariell Jessup with us. As you know, Dr. Jessup is the Chief Science and Medical Officer of the American Heart Association. He is responsible for leading the association's science enterprise, including our science and medical strategy and key strategic science relationships. Introducing or interviewing Dr. Jessup is our own Dr. Patrick or Pat Thomas. He is currently Chief of Cardiology for New York Presbyterian Hudson Valley Hospital and Regional Board Member for the American Heart Association in Westchester, as well as a board member for the Eastern States region of the American Heart Association. Since our time is very limited this evening, I'm going to turn over to Dr. Thomas and Dr. Jessup. Thank you both for being here this evening. And once again, thanks everyone for attending. Dr. Pat?
Icy, thank you. Icy left out the most important part of her biography, which was that 1,000 years ago, she helped train me when we were together at Cornell, when she was a cardiology fellow and I was a lowly resident. So thank you, Icy, for everything you did for me and for the American Heart Association. I know we will still have a couple of people joining on. I'm told we're supposed to have as many as 30 participants tonight, which is a great crowd. And I want to thank you for being with us tonight on this snowy/stormy Wednesday in the Northeast. And it is really my true pleasure tonight to interview a rock star in the field of cardiology, Dr. Mariell Jessup. Couple of housekeeping notes. We have very limited time tonight. The interview / discussion will take about 30 minutes or so. If you have questions, what we'd ask you to do is type them into the chat function. I'll be monitoring that as we go along. And as interesting questions come up, I'll intersperse them with the questions that we've come up with to ask Dr. Jessup through the evening. We will almost certainly will not have time to answer every question, but don't worry if we don't get to your question. We are going to take snapshots of the questions afterwards, and we can send out an email to all the participants with answers. So we'll try to get to as many as we can, of course. Getting back to Dr. Jessup, when I say a rock star, I'm really not exaggerating. Everybody in cardiology knows her work. She's an internationally renowned expert in heart failure. And her really remarkable career highlights include, chairing the writing committee for the heart failure guidelines back in 2009. For those who don't know, these American Heart Association guidelines are really like the Bible to us practicing cardiologists in terms of helping guide us in the way we take care of patients every single day. She was also the national president of the American Heart Association from 2013 to 2014, and she received the American Heart Association's highest honor, the Gold Heart Award, back in June 2018. So we are really quite fortunate to have her on the Zoom chat with us tonight. So again, Dr. Jessup, thanks for joining us. It's a real honor to talk to you.
Well, thank you, Pat, for that very lovely introduction. And I want to say thank you to you and your wife for being pace setters. So that's great. I also want to say hello to Dr. Fergus. Hello, it's so good to see you again. And I also see Glenn Fishman over there. So it's great to see you. Long time no see. And so I'm really pleased to be here. And I want to congratulate all of you for your devotion to the American Heart Association. And I think you can be really, really proud of what the AHA has done during this time of pandemic. And everybody's tired of hearing the word unprecedented. So I've switched over to calling it the chaotic time of the pandemic.
And so obviously tonight, that's going to really dominate most of the conversation. Under other circumstances, we might want to talk about heart failure or other such topics. But unfortunately, the thing that's dominated our lives over the course of 2020 and will into 2021 is COVID-19. And I want to focus particularly on how the American Heart Association has been involved in trying to tackle this monumental problem. But I'd like to start with a couple of basic questions, Dr. Jessup, and can you explain in a little detail to the audience what the chief scientific officer does? What's your day-to-day life like? What do you really do at the American Heart Association?
Well, I have a fantastic job because I do something different every day and practically every hour. So as you all know, we say science is the foundation of everything we do at the American Heart. And so in essence, there's this huge team that makes that all happen. And I reportedly am in charge of all that, although I can do as much as I can and depend on just outstanding staff. But that means including overseeing our clinical practice guidelines, our entire research operation, our entire science and medicine operation, which really edits everything that goes out to make sure that it's scientifically accurate. One of our teams is in charge of lifelong learning, and one of our teams is in charge of our scientific meetings, so scientific sessions. And then when in doubt, suddenly I'll find out something else that I'm supposedly in charge of, including our council membership. So we have about 40,000 professionals, science volunteers that are in one of 16 scientific councils, and that falls under my direction as well. So it's a lot, and I would never be able to even make head nor tails of it without our terrific AHA staff.
So you wear a whole lot of hats.
Well, they wear the hats. I just, now with Zoom, nobody wears hats. We all just talk to another on the Zoom.
The American Heart Association, is traditionally and has been since the 1920s an organization really devoted for many, many decades towards heart and brain health. Can you help walk us through a little bit, why the American Heart Association would want to try to tackle something like COVID-19, which might not traditionally be thought of as in the American Heart Association's lane?
Well, that's such a great question. And I don't know if any of you happened to hear our president, Dr. Mitch Elkin, give his presidential lecture at scientific sessions. But one of the things he did was to go back to the early days of the American Heart Association. And they were all white men, came together to form the AHA because of an infectious disease, which in this case was rheumatic fever. And it was such a devastating problem and had so many profound cardiovascular implications that they really felt that there needed to be an organization to, A, fight the incidence of rheumatic fever from going up, and 2, to deal with the research that was needed to help with that, and 3, to help the consequences of the cardiovascular disease. So in some ways, we've come full circle, that we're addressing a cardiovascular problem in the midst of an infectious disease. I think second, it's really important to remember, and I'm sure you all do because you're so close to the American Heart, we were fighting a pretty big war against cardiovascular disease. It's the #1 killer all over the world. And suddenly, not only did this virus come and start to kill people, but it killed people with cardiovascular disease more often. And so it was natural that people turned to the American Heart for answers and help. And it was really natural for us to say, wait a second, I mean, we've got to get some answers here. So I think that it felt normal and reasonable to say we're key player in this fight against COVID-19. And I think we can just be so excited about the things that the American Heart Association did early on.
So perhaps you could, in just a second, tell us about a couple of those things that the American Heart Association did, particularly back in March and April. But I just wanted to clarify one thing. When I mentioned brain and heart health, I think I confused some people earlier. So the American Heart Association, of course, focuses on the heart, but its sister organization, it's part of the same umbrella as the American Stroke Association. So when we talk about brain health, I was referring specifically to stroke. So I'm sorry if I confused anybody with that.
Well, you're just helping them get sort of current, because now we talk about dementia, but the alternative to dementia is brain health. So it's a very important rubric. And it turns out that all the things that you can do to prevent cardiovascular disease, turns out that it's a really helpful way to promote brain health as well.
Absolutely. Yes, thank you. Back in the spring, the American Heart Association really, I think, pivoted into two areas. And I was hoping you could just explain for those attended tonight about the really rapid funding of a number of research projects that came out of the blue, and the registry that was set up to track COVID-19 patients.
I'd be so happy to do that. So what does the American Heart Association do, and what have we done for almost 100 years? We've funded research. So right away, we said we need to fund research into COVID-19 and cardiovascular disease. And then the story that happened is truly remarkable, and I never get tired of talking about it. From the beginning of the idea to put out a request for an application to the awarding of the grants was 45 days. We made an announcement and said we wanted rapid response funding and results. And we received 750 applications for these rapid response grants, the largest number of applications we've ever had for a single funding model. So we were delighted to get those within a few weeks. And then we said, well, we've got to review these. And we typically have 2 review cycles. And we put out a call for reviewers, and we had 150 volunteers say they would review these grants in a week's time. And so that all happened, and our current officers and some of the science members of the national board did the final review and the final choice of these. We initially funded 11 specific grants and a coordinating center, which is at Cleveland Clinic. And we subsequently have funded 3 more because we had donations from funders to help us fund. So a total of 14. They meet weekly, obviously virtual. There's a website, and all of the data is put on the AHA's Institute for Precision Cardiovascular Medicine platform so that they can share ideas. And the research funding was a wide variety of things, from one grant that looks at blood clotting, one grant that looked at repurposing of drugs for treating COVID-19, one very large grant looking at the entire Kaiser Permanente health, can't say that word tonight, health system, looked at a particular predisposition of patients of color, and because already it was becoming clear that there were people that were being disproportionately affected. So it was, and some of that research is already coming to fruition. Some of it was presented in November at scientific sessions, and some of it will continue. So that's been terrific, and it was absolutely right in the main lane of what the American Heart Association does. The second main lane is our registries around quality improvement. And two volunteers in Texas, Dr. James DeLamos and Dr. Sandeep Das, said, we need to understand who of these patients that are getting COVID are getting cardiovascular disease, because by that time, this was in early April, it was clear that heart attack and stroke and myocarditis was developing for unclear reasons. And so the Get With The Guidelines team, which has been doing quality improvement programs around registries for over 20 years, they got together and within 1 week had a case report form. They pulled together a steering committee, each of whom called their friends all over the country to start registering patients. And by the end of April, people were entering their in-hospital COVID patients. Each hospital made a commitment to put every single patient that was admitted to the hospital with COVID-19, established COVID-19, into the registry. And so now we have about 22,000 patients in the registry, and about 150 hospitals are participating, and over 100,000 days of patient laboratory records. They too presented at scientific sessions, and they've already published a couple of papers. And one more point I want to make, I mentioned the Institute for Precision Cardiovascular Medicine, whatever that is. It's a platform where people can securely put data and share it with one another, all in the same space, because the computing is done in the cloud. They have all the tools they need for analysis. So we took all of the data that was coming in on the COVID-19 registry, placed it on the Precision Cardiovascular Medicine platform, which I will call PMP. And then all the investigators that were entering data, they could go securely onto the PMP and do research around for their own hospital, or they were able to look at what people were doing at other hospitals as well. We're on our third round of invited requests for research that's coming out of that. And there continues to be very, very interesting data. So much so that the United States government we're in discussions with them about continuing that registry as a long-term resource. And we're even beginning to talk to other countries about taking their data. So very, very exciting. Long answer, but both building on the really capabilities of the AHA, and yet pivoting very quickly into two very, very good projects that have I think been impactful.
I have to tell you, I was stunned at how quickly these things came to fruition, and I really didn't believe the American Heart Association had the ability to move that fast. Quite remarkable.
I have to say that they did move really fast, and we have remarkable science volunteers. We have remarkable volunteers anyway, but the science volunteers that were the ones that really became involved here just worked. I mean, for about a month, the investigators that came together for the COVID registry had a phone call every night. And then after about a month of nightly calls, they changed it to about twice a week. I've never seen such dedication. It was really remarkable.
Outstanding. As I'm looking at the chat function, a couple of questions have popped in. I just want to make a quick comment. For those that have not attended them or those that are not physicians on the group, a question came up about what scientific sessions are. I'll just say, very briefly, it's the annual meeting where all the cardiologists and researchers get together. This year it was virtually, but usually it's in person, to discuss the latest and greatest in science around heart disease and stroke, as well as talk about best practices for treatment. Dr. Jessup, I believe you actually were the coordinator for one of the scientific sessions back a few years ago, correct?
Yeah, that was sort of my indoctrination into scientific sessions. I always like to say it is kind of our Super Bowl. So we have all kinds of professional education programs all year long. We have smaller specialty meetings around basic science and quality and outcomes. But so it sort of, if you watch football every week and then there's the Super Bowl, well, that's what scientific session is. And anybody that's in cardiovascular medicine, to have your paper accepted at the American Heart Association is really a big achievement, and almost everybody will remember when they had their first paper or their first presentation at the American Heart. I see Glenn smiling and I see Elsie Clyde smiling, so we can all resonate with that because it's still true.
Absolutely. Before I get to, obviously I have several questions about this COVID-19 vaccine series that's coming out. And I know there's also going to be some questions about particularly underserved communities and how they were affected by COVID-19. But two people have asked questions specifically about heart-related effects of the virus. Does COVID-19 actually attack the heart? Or is the heart damaged as more of a bystander to the inflammatory process that's going on?
Well, that's such a key question. In fact, one of our rapid research grants was awarded to Dr. Mike Bristow, who I'm sure you know, Pat, in Colorado. And he's actually doing biopsies of the heart to see whether it is a viral attack of the heart cells, or they're sort of innocent victims of an overwhelming sense of inflammatory proteins activated. Right now, the current belief is that the heart ends up being attacked by all the antibodies that have been mobilized as part of this infection, as well as proteins, which are called cytokines, that get activated when there's a big inflammatory response. We've all heard about cytokines because there's been a lot of conversation around the deleterious effects of having these very potent proteins circulating around where they aren't normally. So that's what most people think. In fact, we just signed an announcement that we're working with the American Medical Society for Sports Medicine. They've begun a registry of college athletes, not only to look at the cardiac effects in these young, previously healthy people from COVID, but they want to understand the impact of athletes with cardiovascular disease as a long-term. So we'll be working with them to help with a registry, and that will be a long-term registry. Of course, everybody's interested in that, people that are interested in sports, because the impact of COVID on athletic hearts has been reported a lot, and we have to understand more about that.
Thank you for clarifying. I'm getting a little warning across my screen that my internet connection is unstable, by the way. So if I flash on and off, I apologize.
Right. I'll just pretend you're still asking me questions.
Maybe the snow is starting to fall. So believe it or not, we only have about 4 minutes left in.
Yes, he was right. He has an unstable connection.
This is Jennifer. I can jump in. I know that we wanted to talk a little bit about the vaccination and if that is safe for heart patients to be taking, and what we should know about that.
Great. Well, of course, I'm a cardiologist, but I've been doing a lot of reading, and we don't have an official comment yet from the AHA, but myself and several other medical colleagues, including Dr. Eduardo Sanchez, who is our Chief Medical Officer for Prevention and what is a public health physician. What we know is that the Pfizer, but in particular the Moderna vaccine, has been tested in people extensively with cardiovascular complications, and Moderna has done a good job of enrolling older Americans as well, or not just Americans. And we, so far, looking at all the data available for both of those vaccines, do not see any reason why everyone should be able to get the vaccine, and that there's no particular danger for a patient that's had a previous heart attack or a stroke. So that's really good news.
And are there any concerns for communities of color?
I think what everyone has been talking about is they're at very high risk, and they have suffered disproportionately, and so having the trust of each community and to be trustworthy, to work with the communities and hopefully convince everyone to get the vaccine. And we've all heard a lot about that. And we are hopeful that we can use our connections to the community that are extensive, that have been developed over a lot of other programs that the AHA has paid for and funded and promoted, that those connections to the communities of color will help in that situation. But just like there's lots and lots of Americans that say they don't trust the vaccine, well, that's just doubled in communities of color who all behavior towards these communities have not been very trustworthy. So we have a lot to overcome.
Dr. Jessup, I think I have a stable connection again. My apologies. Quick question, as we're running out of time here, just we've talked about underserved communities, and we've talked about a little bit about immunization for the Black and Brown communities. But can we talk just for a second, and if we did already when I was unstable, I apologize, about why COVID-19 seems to have affected these communities so much? You know, in the American Heart Association, we've been looking at social determinants of health for a number of years now, but are there particular things that have made these underserved and ethnically diverse communities at so much higher risk for the deleterious effects of COVID-19?
Yeah, that's a key question, and was one of the things that came out of our COVID registry. First of all, it's not genetics. It's not anything that's different. Black and brown people have the same genetics as white people. So it is social determinants of health, that they had higher exposure and inability to socially distance enough, and had to keep working in more often than communities of white people. So I think it is social determinants of health. There are even interesting data around both Asians and Black people respond differently to the vaccine. That's not genetics either. The immune response to anything is altered by non-genetic factors, but a response to immune. You know, you've always found out that you got a cold more often if you hadn't had any sleep. So there's many factors that affect your immune response. So we'll have to pay a lot of attention to that the vaccines once we convince our communities to take them, that they're working effectively in everyone.
Very good. Thank you. Jen, if I'm correct, we're running up against the time limit here. So I think
Yes.
I'll go ahead and wrap things up. Again, Dr. Jessup, thank you so much for taking time out of your incredibly busy schedule to join us tonight to discuss the role of the American Heart Association in addressing this global pandemic. For those who didn't get questions answered, I can assure you we will, again, review the chat function. Any questions that didn't get answered, we will send out an email answering those points that we didn't address. And I want to conclude by just saying a really special thank you to our core Vitae donors. It's your donations that are funding the life-saving research that really leads to the fulfillment of the American Heart Association's core message. And the core mission really is to be a relentless force for a world of longer, healthier lives. You'll notice we don't say anything about heart attacks and strokes in there, right? It's a relentless force for a world, not just the United States, of longer, healthier lives. And so the pivot that the American Heart Association did in the spring really is keeping right in with the lane of our mission. And ask you all to please be safe during the first winter storm of the season as it goes up from the New York area up to the Boston area where Dr. Jessup is now. And please also stay safe during the pandemic. Thank you guys so much for joining us and have a great evening.